Good morning, and thanks for joining us on TVC Breakfast. I'm Veronica Dan Ikboy. I'm not here alone. I have Ibrahim Shita joining me this morning. Shita, it's good to see you.
It's good to see you again.
Here again
Veronica.
after the inauguration and all of that. Welcome back.
Absolutely, absolutely. It's good to see you. Good morning.
Right, good morning. Now, let's quickly touch on some issues. Just over the weekend, we hear that the Joint Health Workers Union, talking about JOHESU,
Right.
we're asking Nigerians to prevail on the federal government to look into their matter. This issue of their consolidated welfare that they have been, fighting for the past 10 years, that has not been resolved, and they are saying that the government must respond to them and give them what is due them. That is why they're asking the government to look in that direction. They have talked about the injustices in the system, how it is that some adjustments are made for the doctors, yet they are left behind, and all of it. And so they are saying that it is until this is met, their demands are met, that the strike will end, because it's an indefinite one. And now they're asking Nigerians to wade into the matter, and I'm wondering how Nigerians will do that.
It's really very sad. The health sector is one ailing sector that, without that, we can't say Nigeria is developing. And this is one of the carryovers from the last administration to this very new administration that has just hit the ground running, but then been faced with a lot of issues, here and there. There is a fuel subsidy, and now we're talking about the JOHESU, although it's been there since May the 25th, when they commenced the strike, indefinite strike action, as you said. So if we have the medical doctors, we have the physicians, we have the dentists who are enjoying, we can't say enjoying because they've always gone on strike as well, but JOHESU is saying we've not gone on strike for 4 years. And now that we decide to go on strike is because we want our demands to be met. I think it's very sacrosanct because the health sector is very, very important to the development of this nation. So calling on Nigerians to, intervene in this matter, I think it's right because they are there for Nigerians. And I don't know, how do Nigerians talk about it? It's one of the things that we are doing here.
Yeah, well, talking about it, like you rightly mentioned, is one of the things that we can say is intervention. But then, before that action began, there were those who had said that they should wait until this new administration gets on board. If your conversation with the previous administration is not yielding any result, wait. Once this administration comes on board, then you can begin, a conversation with them and negotiate with them to know how to address your matter and not just go on strike because you feel that that is what will force the hand of government to pay attention to you. Yes, we know the attendant impact. We know how it is affecting the hospitals as we speak. They have downed tools, and we know the number of persons needing, medical attention, and they are not there. But then that is not the way to go from my own perspective.
Well, it may not be said that way because...
From my perspective.
Absolutely. But then, May the 25th preceded this current administration. We have the incumbent administration sworn in on May the 29th.
Yeah.
You understand? So it's just a carryover. It's not left to be seen how this administration will tackle this issue. But now they are also talking, they are, shouting their voice hoarse to ensure that Nigerians talk about it, which we are talking about it already. And we'll then wait to see how this government will tackle this issue headlong.
Absolutely, even though there has been talks about health sector reforms, and this is what they are also talking about.
Right.
And we hope that the government will look in their direction now that there's so much on the table of the government. Yes, even the president says he knows that he has his work cut out for him, and we have seen how he hit the ground running, but there are critical areas that Nigerians would want some level of intervention, especially with regards to the health sector. And we hope that they call JOHESU to the table to have a conversation while JOHESU tables their demand, and then we can have the health sector back on track.
Most definitely.